Hello everyone, my name is Pedro and I'm a team member of Indian Health Council's Health Promotion Services Department. We're thankful to be able to present this first episode of the Honoring Mind, Body, Spirit, and Community, Preventing Opioid Misuse series. This presentation will focus on answering the questions: what opioids are, how are they used, and why we should care about them. The information presented to you today is brought to you by Live Well San Diego and IHC's Strategies Project and Tribal Local Opioid Coalition. So what are opioids? Opioid is a broad term used to describe natural or synthetic substances that bind to opioid receptors and produce morphine-like effects. A receptor is where a drug binds to start its action or effect, and it can be thought of as the lock into which a key fits. When we talk about morphine-like effects, we talk about feeling euphoria, which is a feeling of extreme happiness, as well as decreased pain, respiratory depression, which is slowed breathing, and constipation and nausea. Sometimes you may hear the word opiate. That's just an older term that refers to drugs derived from the opiate plant, including morphine itself. In this image, we have an opioid binding to its receptor. The receptor is at the bottom in green, and the opioid is represented by the pink sphere. Once they bind together, the morphine-like effects can start taking place. Moving on to types of opioids. Here we separate types by what is considered legal and illegal. Legal opioids are typically prescribed for things such as sports injuries, dental work, or surgery to help relieve pain. They can be effective at reducing severe pain in the short term, but can be very addictive, especially if they're misused. Younger people are at greater risk than adults of becoming addicted when they're exposed to drugs. In these cases, they should only be taking it to manage severe pain and when no other pain medication works, and for the shortest time necessary. Prescription medications should only be taken under the watch of a trained healthcare provider. Here we have some names for generic prescription opioids such as oxycodone, oxymorphone, tramadol, and phenylene. In the parentheses, we have some of their brand names like Oxycontin, Percocet for oxycodone. Then in the brackets, we have some of their street names for oxycodone. This includes names such as Blueberries, Oxy, Roxy, M30s, and Perks, just to name a few. This is not an all-inclusive list. Moving on to illegal opioids. These are powerful opioids sold on the street, and they're used recreationally. And when we say recreational drugs, we mean drugs that are used without a medical reason for its psychoactive effects or to get high. Heroin is an addictive illegal drug made from morphine, which is a natural substance that is found in the seed pod of opium poppy plant. There's also fentanyl, which is another type of opioid that is similar to morphine. It is 50 times stronger than heroin, and as a prescription, it's used to treat severe pain and is also used in surgeries for anesthesia. But it can be made and used illegally. It is sometimes added to heroin or to other drugs, which is called cutting, and can cause strong and unpredictable drug combinations that can lead to overdose death. Here in the images, we have some fine white powder, and this is the purest form of heroin. Next to it, we have brown, which can sometimes be black powder, and this is a form of heroin that gets its color from additives and is more common than pure heroin. And below these, we have black tar heroin. This is a heroin that comes as a black and sticky gel. On the top right corner, we have some blue pills that say M30 on it, and this is what is legally prescribed as oxycodone. However, there are ones that are counterfeit and exist in our county, and these are known as pressed blues. They resemble these oxycodone pills, but actually contain fentanyl and can lead to overdose deaths. Here we have an image of fatal doses of heroin, fentanyl, and carfentanil on the bottom right. Carfentanil is typically used by veterinarians to sedate or tranquilize large animals such as horses and elephants. And in this image we look at opioid potency, or how strong it is, which is important to know since all opioids can result in deadly overdoses, particularly when they're misused to get high, or when they're combined with other drugs like alcohol or tranquilizers, or when used for pain without proper medical supervision. So, how are they taken? Before we get into that, it's important to know how they can be misused. For example, taking prescription drugs as instructed, or taking more than prescribed, or taking more often than you're supposed to. Taking or using someone else's prescription, whether it's a friend or a family member's, even if you're using it for a real medical condition that you might have. Or taking prescription drugs to get high, or mixing prescription opioids with alcohol or other drugs, or crushing pills or opening capsules, and then dissolving the powder in water and then injecting the liquid into a vein, or snorting the powder itself. And right here we have some common routes of administration or how they're taken. They could be smoked through specific pipes that are specific to heroin, snorted, so they're breathed in through the nasal canals, orally if they come in pill form, it could be swallowed, taken through the mouth, or injected if it's in a liquid form. The opioid epidemic. So this is also known as the opioid crisis, which began in the 1990s with overprescription of powerful opioid pain relievers. They quickly became the most prescribed class of medications in the United States. In the late 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to prescription opioid pain relievers, which was not true. Just some information, about 80% of people who use heroin began first misusing prescription opioids, and that is information from the National Institute on Drug Abuse. It's important to know that drug overdose is the leading cause of accidental death in the United States. There are more drug overdose deaths in America every year than deaths due to guns and car accidents combined. So, what does this look like to us locally? Here, we have data that was provided by the San Diego County Prescription Drug Abuse Task Force. It can be found in their 2019 report card, which provides data on the scale of prescription drug abuse in our county. On the top table, we notice that in 2018, there were a total of 246 deaths caused by prescription medications. Of these 246, 210 of these risks were specifically due to opioids. On the bottom table, we look at how these 246 prescription-caused deaths looks like when we break it down to race and ethnicity. Here in the middle column, we have the actual number of deaths, but we also need to pay close attention to the death rate on the right column. This rate is important since this lets us see the disparities in prescription-caused deaths when we compare race and ethnicity. As we can see here, Native Americans have a prescription-caused death rate of 33 per 100,000 people. This is almost 3 times higher than that of whites and 4.5 times higher than the average of all race and ethnicities in San Diego County. Next up, in 2018, heroin and fentanyl were the leading opioids detected in accidental deaths in the county. These accidental deaths included drug overdoses, as well as other unintentional deaths from accidents such as car crashes and falls. Although in some of these cases the opioids were not the main cause of death, we know that use of drugs can impair judgment and coordination, which can lead to risky behaviors that can cause death, such as driving under the influence or when intoxicated. Here we have an image provided by the California Opioid Overdose Surveillance Dashboard, which shows us that in 2018, the zip codes associated with local North County reservations had the highest prescription pain medications per person in San Diego County. And these zip codes are shown here in the darker areas on this map, with the highest being 1,586 prescriptions per 1,000 residents. This was about 3.5 times higher than the rate for the whole county, which was 420 per 1,000 residents. So what do these numbers mean for us? There are a higher number of prescription opioids in our communities, meaning that there is a higher potential for misuse. And based on prescription-caused death rates, Native communities are at higher risk for prescription-caused death when compared to other races and ethnicities in our county. Please tune in next week as our prevention and early intervention team goes into the warning signs of opioid abuse and misuse and the influence of mental health and stigma on opioid abuse. Further, we have some resources which you are more than welcome to look over and provide some local and county resources. And in the meantime, if you or someone you love is struggling with substance abuse, please feel free to reach out to our Behavioral Health Department or dial 211 to reach the county's Resource and Information Hub for further resources.